Well, hi everybody. I'm Kevin, and you've made the mistake of clicking on my QR code. But now that you're here, I thought that instead of doing the normal clinical question of the week, I thought we'd just kind of go to a clinical topic of the week and just introduce a few other things. The first thing I thought I'd start with after hearing about a call that went down a while ago is I thought this week we'll just talk quickly about sickle cell disease just for a few minutes. So sickle cell disease is a disease that's genetic, and people who have it end up having red blood cells that don't form normally. So a percentage of their red blood cells don't have a nice normal round shape that's really bendy and moves through capillaries nicely. They have these crescent shape or sickle shaped cells that are brittle. They only last about 1/10 of the time. They die after about 10 to 20 days and break down, usually in the spleen. And they don't do a good job of transporting oxygen. So because of the breakdown and their decreased oxygen carrying capacity, these people are frequently anemic and sort of have some low oxygen. So they're fatigued. It can be pretty common in people with sickle cell disease to have chronic fatigue. In addition, they're kind of more prone to infection because you can get some spleen damage and your immune system is a bit compromised. Then get episodes of swelling. But really, one of the most important things, I think, is to recognize somebody who's in a sickle cell crisis. So a sickle cell crisis usually occurs because of what's called a vaso-occlusive event, where these crappy little sickle cells end up jammed up in some capillaries or some of the vessels of the body, and they can cause excruciating pain. This pain can be anywhere: arms, legs, chest, back. It can kind of range from person to person and from time to time. The one thing that's reported consistently is that the pain can be unmanageable. A lot of people with sickle cell disease will have a plan at home, they'll have some access to medications, but if these are severe, we may be called and we may see somebody with it. A couple of key takeaways on this is with sickle cell disease, you're going to want to just sort of course, follow your normal call stuff, get a full set of vital signs, find out that they have an established history of sickle cell disease. And one of the key factors in dealing with somebody with sickle cell crisis who has a lot of pain is to believe them. They have a ton of pain. It's supposed to be excruciating to debilitating for some people, and they need urgent treatment. The go-to in hospital is usually opioids. So that's something to consider, for ACPs, and hopefully as scope comes about over the next couple of years, that'll be more of an option for us. But there's also the option to use our usual pain management techniques and consider the use of nitrous or penthrox as well, which isn't contraindicated, but because it's so rare, you might want to consider a call to EPOS just to discuss. The other thing that can be useful is a little bit of fluid. People are frequently dehydrated, so some fluid can be helpful, but they can also have comorbidities like heart failure, heart disease. So you really want to rule out things like pulmonary edema and make sure that that fluid bolus is going to be okay. Again, because this is so rare, I don't think a call to EPOS would be such a bad idea, but you do want to either give early pain management, early transport, get them to the hospital, and take their pain seriously because they're going to need opioids. If ACP can attend, or if you're thinking this way, or if you are an ACP, I suggest definitely look just to morphine, fentanyl, and breakthrough pain can be ketamine as well. So all that considered, take it seriously, treat their pain, do a normal call, but sickle cell disease can be one of those kind of hidden things where the pain complaint can seem disproportionate to what you're seeing. Please believe them, treat them appropriately. Thanks very much.